So you just had a beautiful interview with New Beauty and sharing your experience here, and I appreciate that, and it's great.
Of course.
It's nice when you have a patient that's really willing to talk about this and talk about their experience. That's really important for other patients to see, and
Yes,
I'm sure
I
you
agree.
looked for that when you were originally looking for
Yes.
having a procedure done. You do your research and you see these things, and it's good to talk about that. So I wanted to ask some specific questions as to what initially was. And first and foremost, when you were thinking about doing this, did you know all the areas that we were going to do, or did it kind of evolve over time?
I think it evolved over time. I really trusted you to tell me where you think, I would really be happy with my body in the end. As you recall, you wanted to do my legs, and I was like, no, let's leave the legs alone. You recommended the arms, and I almost changed my mind on that. And I'm glad we did it, because it's almost like when your room is messy, but you make your bed, right? And the bed is made and the room looks good. Like if my arms weren't done, I don't think the whole look would look like this. So I would, if I recommend anyone, just go in and talk to you, because I recommend a lot of friends to come to you. Just go in and talk to you and let you tell them what they think they need. You're not a salesperson. You're not going to force anything down their throat. But you have an eye that we don't have. I think part of your life is you're an artist, and so you really know how to say, hey, I know what will look good, and let me do my best.
Thank you. And I appreciate you saying that, because, when you first come in, you may say, okay, I want to maybe do my tummy, or I want to do my breast. And I like to kind of, we put you in a gown, we looked at you, we just kind of comprehensively look at everything, and we kind of made like a wish list of things that you may not have been even thinking about. Or things that we're not even going to do the first time around, or something that you say, it's kind of like, you go to talk to an architect and they kind of look at your whole house and then talk about the different things, that whether or not you want to renovate a room or different things. And it doesn't mean you have to do that. And you're gorgeous already, even before you walked in here. We just had to tweak things a bit.
That's right.
Right? So, and that's what it's about. Now, fast forward, we did a mommy makeover. We did an abdominoplasty. We did fat transfer. We sculpted everything. It looks really good. Right after surgery, I'm sure there were days that you were like, how did this happen to me? Why did I do this? How many days after was that?
Do you want me to be honest?
I don't know if they asked you that on the interview. I want to be dead on. I know it happened. So
I think that I'm not the normal. I have friends that came out of C-sections and they were doing laundry within days. So I am definitely on the other side of that. So I think I cried for about 3 to 4 weeks every day. Yes. Even though I was seeing the change, I was just like, wow, this is what I had to do to get here. And now I'm proud of it. Now I'm proud that I didn't give up, because you can't give up. You can say, I'm not getting any massages. I'm not going to any of my appointments. And you just, no, I didn't give up. I did everything you told me to do.
Thank you.
And here I am, and I'm happy. I'm happy that I stuck with it, because I was miserable.
And I'm so glad that you're real about it, because there is a range. Like you said, there's some people that do really well and they go out and they're doing great, and some people that takes them a while. And some people, and most, even the ones that are doing really well, few days after surgery, there's a huge regret that comes over you. Like, I shouldn't have done this, especially when it's your face. I should have done this. I recently operated on a plastic surgeon. She does this, right? She knows exactly what to expect. And her face was super swollen. Of course, for her, it was even more swollen than it is normally. Same skin tightening that I did. And she was crying 2 days after surgery. So I had to, she's a colleague, and I had to talk to her about it, right? So it happens because you see yourself differently. You go through it's not just a body thing, it's a mental thing that you have to go through, and you become one with it. So that's really important, and thank you for sharing.
And I think people think that it's like that, right? You wake up and you're going to have the body that you dreamed of. No, it takes time. You have to heal. I think I'm still changing. I mean, right? Okay.
It is, and changing for the better.
Yes. It's not immediate. You have to work at it. You have to do the things that your surgeon tells you to do. And I'm happy.
Great. I'm really happy for you. This is wonderful. Thank you for sharing your experience.
Of course.
Okay.
Yes.